Thank you for your presentations. I found them very insightful. I'm sure you guys did too. We do have a few questions that have kind of come in that I wanted to kind of start with. And after they answer them, we'll let you guys go ahead and provide other questions if you have anything that you'd like to ask our panelists. First off, if you guys would just give us some information, and you guys have mics on, we're all working, right?
One, two, one, two.
Yeah. What areas in healthcare could benefit greatly from innovation, since this is our innovation conference? Start with you, John.
Oh, there's so many areas. I think one of the areas that traditionally has been innovative is, as we may know, is radiology. Radiology started using voice recognition and transcription while the radiologists were looking at the images. They were actually doing dictation at the same time. That was going into the patient report. I think that is one area that's going to continue to innovate. For example, there's computer-aided diagnosis. So there are tools out there that are getting better and smarter in helping identify on the images areas that the radiologist should pay more attention to. So the technology is looking at the images, analyzing images, and saying, this is something you have to take a second look at. So my first answer to that, just because it's near and dear to my heart, is radiology continues to be innovative.
Thank you. Bob?
Yeah, I think I would go down the path of anything involved with the effort to bring about value-based care. So you're talking about population health management, so there's aggregation of data, there's information about patient engagement that we talked a little bit about. There's challenges with costing and having information to be able to analyze across multiple care settings. And so I think there's tremendous, there's community-based resources and app-based resources, all of this good information that can help us in improving our own health and the health of communities is coming along, but there's a whole lot more to do in that arena. So I see tons of innovation in the population health arena.
What about you, Teresa?
I think I'm going to lean towards interoperability because it's either we give too much data or too little data, not at the right time. I've got to go search for it if I'm a physician. How do we make that more user-friendly and the right amount of data at the right time? I think there's real opportunity in that as we move forward.
Great. Thank you very much. Can you guys provide some insights into emerging technologies that are continuing to or will start to bring in and have a large impact in healthcare? You want to go first this time, Teresa?
Oh, sure. Oh, sure. Now I have to think real fast. Emergency, yes, because I think we continue. I'm going to continue down this technology path on interoperability. We're starting to see some real cool apps, such as FHIR, that have some possibility for us in the future. And especially if we're able to, and John, I like your idea about the radiology and being able to query and pull radiology across, and across HIEs, across borders, and across the nation.
Bob?
I'd say ask us in a few months. We're doing an emerging technology study right now.
To be determined, huh?
But I mean, again, there are things happening in a ton of arenas. Cybersecurity is actually one where there's a lot of innovation occurring because there's a need. So almost wherever there's a need, I would say anything that's app-based or FHIR-based, there's a lot of progress occurring there. And people are finding it easier, I wouldn't say easy yet, but easier to innovate given some of these facilitating resources. So, but I would say, and then I already mentioned population health, but I think there's a lot occurring there to bring information into organizations so they can make better decisions.
Yeah, my favorite one is artificial intelligence. And having done these hackathons and competitions, many of the teams had some version or inclusion of artificial intelligence in their solution. And one of the winners, for example, had a interactive video with artificial intelligence so that you as a patient, instead of seeing maybe some of the standard videos about your operation, it would be interactive. So you could actually talk to an avatar and get some real-time feedback on that. So artificial intelligence a la technologies like IBM Watson, are really going to change and move the industry forward. And if anybody was at the HIMSS conference, you may have enjoyed Ginny Ramadi talking about IBM Watson. And this, a lot of people are worried that it's going to replace the physician, but of course it's not. These tools are just going to complement and help them make better diagnostic decisions along the continuum of care. So AI is one of my favorites.
Can I throw out
Sure.
precision medicine and genomics as well?
Absolutely,
Again,
absolutely.
a lot of opportunity there that is yet to come or coming. And so I think there's a lot of innovation there.
Yeah.
And I'm going to throw out natural language processing. Because as much as we think we're digitizing each piece of the data, what we're finding is physicians still love their notes. And there's such valuable data in those notes that we can use to help the physician better treat the patient.
Yep. All right, thank you. Bob, you talked a lot about usability. How does usability help solve the interoperability question? And if both of you would also respond.
Yeah, I guess I'll go back to my analogy. You've got to be able to use this instrument well before you bring in the other instruments. And I think if individuals have not figured out quite how to make their EMR sing for them, then it's going to be very hard for them to bring information in from another source and have that be useful. And so I think they're closely tied together, and the better we're able to use our existing suite of services, the more able we're going to be able to integrate other information. So I think it's a foundational challenge.
I have to agree. Workflow is everything. We've got our physicians with very little time to treat the patient. And when we burden them with additional functions, what we end up with is they just don't use it. They don't have the time. But the ability for us to embed dashboards, embed the right analytics so that they can quickly see at a glance what they need to do, it allows them to use what they're very skilled at, their diagnostic ability, their ability to identify what is really going on with the patient and see the patient.
Agreed. And the one area that is always interesting is when you do go to one hospital and your records are at another hospital, and you need that to make the correlations or not repeat the procedures. Today, there are EMR vendors that do have solutions where you have to initiate, if you will, a release of information, and that information then gets shared. But maybe in the future, we see that kind of automated so that somehow there are algorithms out there that know that your information is either in the HIE or at the hospital down the street, and that information can be brought together under one place for the physician so that they can see this information. They didn't know they needed to know when they started their encounter. So it's having the system do all that behind the scenes stuff that they may have not had any idea existed. Yeah.
Which should probably go a long way to help with adoption of a lot of this, I would
Yes,
assume.
yes.
Just that knowledge
Usability,
base,
yeah.
which has been somewhat slow, I would think. What do you see as, what can be impactful with increasing the adoption of interoperability with your user, with the users and the caregivers out there? What can stimulate that adoption and interoperability?
I think there's multiple levels that can occur on, right? It can start with collaboration, right? So if to the extent we're not collaborating with each other, whether that's vendors to vendors, providers to vendors, providers to providers, health information exchanges, all of these things, to the extent we're not collaborating, I think we can do more collaboration. There's technology solutions as well, new and creative ways to approach things, and standards as well. So we talked about FHIR. Can that motivate and encourage more exchange of information? Yes, I think it can. And so I think it's on all these fronts where I think we're going to need to see more effort to come together. We'll have to find technological solutions. We'll have to find relationship solutions, and bringing those together will allow us to share information to where we started this, for the benefit of patients.
Yeah.
So I'm going to call it out, money. So it is hard to change. It is hard to collaborate. It is hard to get all of this implementation of change in the systems at the provider and hospitals, where is the value-based reimbursement? That is what could incentivize them because they get rewarded for embracing this technology, for really taking care of the whole patient. Let them get the benefits and rewards of that, and letting that incentive monies go to the provider and hospitals for them embracing this technology.
I have an idea. You know, some of the innovations that came out of these competitions involved blockchain. Of course, Bitcoin was built on that. And so we saw some innovative solutions where the patients would get rewarded with Bitcoins based on their behavior and following a treatment plan, et cetera. Why don't we do that for the doctors?
Gamification.
So why don't we give the doctors Bitcoins when they have done their value-based care?
I love it.
Yeah.
Well, we have about 5 minutes left. I'd like to open it up. Got questions?
Yes, I have a question for Teresa. Actually, so I think there's been discussion about this before, but I'm really interested in your perspective on when we might be able to have a statewide image exchange in place where we can exchange images from facility to facilities, and providers to providers, and all of that.
I think we're just working on the business model. I do know we keep talking about it, keeps dangling out there, but we don't have enough momentum to really move. But I would be very excited to try that. What is interesting is in our work with Colorado and our connection with Colorado, they do have image exchange. And what's interesting is when we get their patient summary from Colorado, their image is embedded in there. And so I thought this is a wonderful opportunity for our physicians to take a look at that, see if that's going to meet the needs without us investing one dime. And that will allow us to maybe create the business model to be able to bring in image sharing as well.
In addition to being better for patient care, I know there's a huge amount of savings in us being able to do that. If we could just identify what those are, kind of help the business model.
I would agree with you. I know that our hospital in mid-state is frustrated because when they treat a patient on an emergency basis, they put the image on a disc and put it on the patient's chest and send the patient up. But the hospitals up here, and I don't blame them, I mean, we got the cybersecurity people here, aren't real comfortable in just loading this disk in their systems, and they don't know what viruses that might contain. So an opportunity, definitely an opportunity.
Back there in the back?
With organizations like Interoperability and Commonwealth providing the framework for data sharing, how did the role of HIMSS change?
So both of those are a little different because they are vendor sponsored. And so they are great for the large vendors. As you know, Commonwealth is built on a large vendor system. Data is governed by a board of that vendor, not locally governed. And I think they're not as interested in the small players, long-term care, home health. Care quality is an interesting one, but they're only sharing patient summaries right now. No linking of the patient matching, no notifications. And that is one of the most valuable services we've seen, is someone knowing, a primary care knowing their patient has just entered the emergency room and they need to either call and coordinate care, especially if they're a high-risk behavioral health patient, coordinate those drugs before that patient is taken care of. So opportunity, I kind of like what Bob said. I think you got all these pieces going. We got care quality, we've got Commonwealth, we have Chic, which is the HIEs nationwide connecting together. That's okay. We saw it in the financial world with the clearinghouses. And we saw the clearinghouses played an important role in normalizing and routing that data securely.
I think we have time for one
Also-
more question. Oh, sorry.
Just one point. HIMSS has an initiative as well, HIMSS Enterprise Imaging, and they are addressing the image sharing as well. And I know different states, including Ohio, are working on that statewide image sharing initiatives. But there's an organization called SIM also that is working on it with HIMSS on that.
So my question is, how do you handle the variation in the bandwidth capabilities of different systems when you're transporting those images, depending on, some of them take a very long time to render, and they take up a lot of juice for being able to so if, are you talking about store and forward, are you talking about consolidating and crafting an image in real time? And not all systems are capable of or have access to the bandwidth to actually be able to transmit the data, so thus the use of the disks. So because of the size of some of those image files, that would be my guess.
I can just briefly comment on that. The question was, how do we share images statewide with different variations on the bandwidth and because of the size of the images? And so that is an aspect of the architecture that's in place, for sure. And I would say maybe as these initiatives move forward at the same time, we'll all be on fiber.
I would say that the solutions we have seen are store and forward, so short time store and then forward, because they know how often the radiology images are accessed. It's usually in the last 30, 60 days, so it's not a lot of store. But I am excited to see this go a little forward because I see sharing not only in a portal, but sharing with IHE profiles,
Yep.
which is very exciting to see that real-time sharing.
Exactly.
All right, well, I think we're at time. Thank you, panelists. We really appreciate
Thank you.
Thank you.